me today. I'm here to speak to you about tracking SARS-CoV-2 in wastewater systems as a system-wide approach. Now, in terms of the few things that I would like to cover throughout this presentation today, I would like to start off with a brief problem definition. I will walk you through why wastewater testing can help towards COVID-19 tracking throughout Canada, and I'll share some lessons learned from Ontario studies that we are currently undertaking right now. What are some of our research questions? So some of the big questions I will discuss with you. Our research approach, what are some of the innovative solutions we are bringing forward from McMaster University, and how can you participate if you in your municipality is interested in participating in this study? As most of you probably know, the number of COVID-19 cases are on the rise again. In Ontario at least, we're tracking very closely, but again, throughout Canada, similar trends are seen. Our numbers are growing, as much as we don't want it to grow, it's growing. The world is desperately looking for vaccine or an effective treatment to help us contain this SARS-CoV-2. Currently, the best tools that's available to us is really clinical testing or any other kind of innovative methods that we can come up in order to monitor the severity of this disease at the community scale. Currently, we see ongoing challenges with clinical testing, both in terms of reliability of the test kits. We have seen both positives as well as negative, false positive and false negatives with clinical testing. There's issues around cost, logistics, and obviously inherent limitations around what can clinical testing provide you with information. For example, clinical testing provides you information around for the tip of the iceberg, which simply means people who are showing severe symptoms are the ones you can track using clinical testing. However, the ones who have symptoms around mild symptoms or the ones who are showing no symptoms at all, those are the ones which we are currently not tracking. As I currently mentioned, this is one of the key problems. We don't have enough data to kind of exactly tell how our communities are doing. We just know the information based on clinical testing, and it's an incomplete information around how many people are actually infected with this. And especially if vaccines are going to become available, another key questions are starting to appear. How effective are these vaccines and how well people are responding to these vaccines as well? So how can this wastewater testing can help? Well, wastewater testing is not the first time that we are asking to use for tracking viruses. Wastewater testing has historically been used for tracking and detecting pathogenic enteric viruses. We have used it for eradicating poliovirus. We have used it for tracking rotavirus and many other kind of enteric viruses as well. We have used wastewater as a testing and tracking method for finding information around how communities are using drugs within their own neighborhood, especially around pharmaceuticals, how different communities are doing in terms of use of pharmaceuticals and how those pharmaceuticals are being discharged from neighborhoods into the wastewater plants, and can we track really pharmaceuticals in order to better tell how is the community health overall. The virus that causes COVID-19 has been detected in untreated wastewater in a number of jurisdictions around the world. On a daily basis, we're hearing more and more stories around SARS-CoV-2 being tracked in wastewater. We have studies from the United States right now which have proven that it works for them. Netherlands, Spain, Italy, Turkey, Chile, Brazil, Pakistan, India, Japan, Australia, and Israel. These are just a few of the countries which have already started tracking wastewater for SARS-CoV-2. Mind you that most of these countries which are listed here are the ones which have already potentially seen the first wave before Canada went into the first wave. So we have examples from other countries that it's working. But again, it's also important to realize that many of these countries, what they're trying to do is they're trying to use universities or very specific labs to do this kind of testing. And again, this is really, really important to understand what other people around the world are doing. As much as they're looking for these biomarkers, there is still, there is still room for improvement in terms of approaches and techniques. In some cases, some countries were also able to detect SARS-CoV-2 even before clinical testing was performed in the community. So, which simply means that wastewater testing could potentially be used as an early warning system before we start using clinical testing in those specific neighborhoods. Also, we should know that wastewater testing can potentially help decision makers when they're making decisions around how the economy needs to be reopening, and again, if it needs to go back to lockdown scenarios. As I said, it can help us provide many different information. For example, we can get a true estimate of how many people are actually infected within our population, because it will help us track not just severely symptomatic patients, but also patients who are mildly symptomatic or patients who are not showing symptoms at all. Everyone is shedding off this virus if they're being infected at some capacity. Our bodies are shedding off virus in different concentrations. So again, we can use that information to track it within the wastewater. It's a non-invasive technique that we're trying to use, and what we plan to do, what we're hoping to do within Ontario right now, and hopefully we can expand this to rest of Canada as well, to really include this as part of the existing testing framework of wastewater system. Wastewater is a very regulated industry. We test for various different things. Right now, our wastewater systems are not testing for SARS-CoV-2 because of some gaps and opportunities for us to invest in those areas. So again, I will talk about those things once I get there, but I wanted to highlight that to you. So at McMaster University Booth School of Engineering Practice and Technology, what we're hoping to do is to develop a roadmap for best practices that could be adopted through partners across the province. We have started off with a system-wide approach for the province of Ontario, but we are hoping that any of the work that we are doing right now could be expanded and lessons that could be shared even outside Ontario right now. It will help, our study will help to determine the capacity of local facilities to detect COVID-19 earlier and more effectively, measure the effectiveness of future vaccines, and expand the scope of detectable harmful pathogens by employing bottom-up approach. And I will walk you through what that exactly means. But in simple words, what I'm saying is universities are not designed to do ongoing testing and sampling. Yes, as a standalone approach, we can do sampling, we can do testing, but in a long scheme of things, we need to make sure that this wastewater tracking of SARS-CoV-2 can happen within the existing framework of testing that's already happening throughout Canada for various other things. So what is McMaster University proposed research? Well, what we are doing right now is we have a consortium. We call it a COVID-19 Wastewater Consortium. Right now, it's for Ontario, but we have a few partners from outside Ontario as well. And we're hoping that after this presentation, some of you might have interest in joining as well in various different capacities as well. We're trying to build capacity by leveraging existing framework of wastewater testing processes and facilities. We're trying to make sure it's a system-wide approach. Every neighborhood is different. Every community is different. Every wastewater will receive inputs from a variety of different communities. For example, it could be areas such as long-term care facilities, it could be schools, it could be universities, it could be remote communities, you name it. Everyone eventually discharged into the collection system and eventually gets to your wastewater treatment plant. So we're hoping that we can track it all the way to the neighborhood level to be able to understand how this disease is spreading throughout our communities. And even if we have to do lockdowns and really release any kind of resources, we know where it needs to get released through wastewater tracking. We are doing currently a comprehensive assessment of the current status of various existing plants, their systems, in-house labs. We know there are licensed and accredited labs. We're working very, very closely with a lot of our different partners right now to perform a gap analysis. We're also doing a feasibility study on building local capacity for various plants, understanding that every plant has different processes in place. So we're fully open to making sure that we work very closely with our partners to give them feasible solutions. It will be informed by science. Science is being produced by so many stakeholders all around the world, even scientists around Canada also producing science of what needs to be done. We are conducting and we will be conducting small-scale pilot tests to establish proof of concept, to develop local capacity, collectively identify a range of local implementation options, scenarios within Ontario's wastewater testing framework. Finally, once that's in place, we hope to come up with a system-wide deployment in Ontario. Our end product is something interesting. We are working towards building an artificial intelligence platform, which would be used for tracking and assessing SARS-CoV-2 in wastewater systems, and obviously expand that to future vaccine effectiveness program as well. Most of us have seen a top-down versus a bottom-up approach. But this is very interesting. COVID-19 has shown us that we have to really change how we do things. Normally, under normal circumstances, and I'm just going to open my laser pointer so I can actually show you a few things. So this is usually what we're used to. We are used to seeing top-down approaches, which is basically focused on science. There are scientific research and findings. We come up with evidence and general approaches, processes, and standard operating procedures. As I said, these parts are being done right now across the world and some places within Canada as well. And usually these changes are then recommended in a form of legislations, policies, and eventually it trickles down to your wastewater plants. And now within wastewater plants, you must adapt now to these new suggested recommended guidelines, policies, and legislations. And eventually when this top-down approach is done, you start with the bottom-up approach, which eventually starts with you looking into your municipality, start looking into, do you have the budget to even look into including more testing and so forth. Again, and usually after top-down, the bottom-up approach start. But again, with the COVID-19 nature, we have seen that there's one thing that we don't have right now, we don't have time. So what we are trying to do right now, as the science is being produced by the rest of the world, we also have started something called bottom-up approach. So this is what we are focused on right now within McMaster University. We're trying to identify local realities, risks, and opportunities. As I said, it will be informed by science. Science is produced by Canada, science is produced by the rest of the world. We're testing a range of options. We want to make sure that we can inform policymakers and decision makers and seek any sort of funding for infrastructure upgrades if there is any that's needed. Establish a range of feasible and cost-effective processes and solutions that can be implemented. But as I said, while we're waiting for this top-down approach to be completed, given the urgency and need for rapid solutions and risk management, we need to start up with the bottom-up approach. At the same time, while the science is being refined, we cannot wait for this approach to be completed, but instead we need to work together to make sure that that's working for us. Now, in terms of the research approach, as I already kind of mentioned, that we are trying to come up with the roadmap for best practices and approaches towards achieving a collaborative province-wide development of SARS-CoV-2 testing through a bottom-up approach. So we are really focused on ground realities. There are lots of different things we're doing, and I'm going to highlight a few things here without overwhelming all of you. But we're right now looking at methodological research. So we are looking into what is the science that's being produced by the rest of the world, and what's the work that's being done by some of the Canadian universities here. We're also doing our own gap analysis and feasibility studies in order to identify those local realities and challenges within the municipal sector right now. We're also doing policy research and analysis to begin with. We have already started work on this one. We're we're doing stakeholder consultation. We already have more than 100 plus wastewater facilities on board. We have some of the key partners already on board from Ontario right now. We are looking into risk assessment and implementation scenario analysis at the same time. We are working on a data management portal right now, which can help us collect all of the sampling information and really guide where the samples needs to be collected from, how they need to get transported to certain places, and how it needs to get tested. And eventually, the results will be all compiled in a data management portal, and eventually we'll be using artificial intelligence system, which is going to be based on various different types of algorithms to help us predict various threat level assessments and reporting mechanisms and so forth. Along with this, we're also doing small-scale and large-scale pilot tests to track SARS-CoV-2 in your neighborhoods, within your wastewater treatment plants, throughout your collection system. So we working very, very closely with our partners through focus group discussions to outline what are those hotspots are going to be based on clinical tests, and making sure that we are collecting samples from potential areas where the outbreak has potentially occurred from the first wave, and really streamlining where the samples need to be collected so we can identify SARS-CoV-2 in wastewater to really confirm the technique is working, and really to understand what's happening once the SARS-CoV-2 is released to the collection system all the way into the treatment plant. Are our current processes that's in place, is it sufficient to remove or inactivate the SARS-CoV-2 once it enters the plant? Along with this, we are also co-developing new rapid testing technologies, which includes biosensor technologies. Right now, because nobody around the world is looking into if the virus is being shed off, is this a complete virus, or are we shedding it off as a fragment? Because the technique we are using right now is just tracing fragments of virus, which is really the component of the virus, which is the RNA basically. So we're not actually looking for a complete virus. One of the key things we're trying to do within McMaster University is to really look under the microscope. We cannot look at it under a light microscope. It needs to be an electron microscope or a scanning transmission electron microscope that we are trying to use right now to look for intact virus. Once we find an intact virus, then obviously the other set of questions arise. Is this virus reproducible? If it is reproducible, is there any sort of health and safety concern for people who are working in the wastewater industry? Lots of different types of questions needs to be asked. But anyways, as biosensor technologies could be very, very beneficial in areas to give an early warning systems to areas where we're trying to collect samples, or even within the wastewater treatment plant, an early warning sign, is it present or is it not present? We're also trying to come up with rapid testing kits. I worked in the water and wastewater industry for a very long time myself, so I do understand the needs for operators, the frontline staff, and what kind of kits and things that could be very, very useful to be utilized for field studies and so forth, and give us real-time information. We also co-developing new methodologies and processes, and really the goal is the scalability and transferability, and obviously making sure it's going to be a cost-effective solution. So lots of different things we're doing within McMaster University to make sure that we can come up with a cost-effective and long-term solution, long-term sustainable solution that can stay there for a very, very long time with us, not just for COVID-19, but hopefully once we have the system in place, we can use it for vaccine effectiveness program, but also for if there is going to be any future pandemics or even third wave for SARS-CoV-2. Here are some of our key research questions. There is growing evidence that coronavirus is present and detectable in wastewater system, raises various different questions, and we are focusing on at least the first 4 questions to begin with. How can we optimize wastewater-based testing to track COVID-19 spread in the community and inform decision-making processes? How will the potential waves of the current pandemic, future pandemics, or emerging issues impact the business as usual for testing at wastewater industry? Are higher levels of lab security going to be needed, and what cost? So again, there's a different lab security that's needed as soon as you start looking for the virus. It raises concerns because we are dealing with a virus now. We are used to dealing with bacteria. But again, as soon as we start tracking or tracing virus, it triggers a lab security. Do we have that lab security within our current existing framework? How can we develop a rapid testing kit that can be employed for quick and reliable testing on wastewater sites? So something that can happen real time, something that can be connected to your SCADA system, for example. How can we measure the effectiveness and durability of COVID-19 vaccine campaign using wastewater testing and tracking? So again, this is going to be a very, very important question, as probably as most of you are following the news right now. And obviously there are more than 150 companies trying to come up with vaccines right now. But one thing, the latest research is showing that the immunity to the vaccine is not going to be long-term. So we need to have a way. We need to find a way to really track this vaccine. Once people start using it, we need to really find a way to figure out when does that immunity. When does the community loses that vaccine immunity again? So when do we need to do a booster shot again, for example? What are the potential impacts of this virus if it is found that the detected virus is viable and not just a fragment on source water as the economy is opening up, and at the same time with a climate change threat? For example, combined sewer overflows and things like that. What's going to happen to our source water? And obviously, we want to answer all of these various different questions throughout this process. Again, you have to understand this is a very complex system we're talking about when we start talking about Ontario's wastewater systems and testing. Currently, we have many municipal systems. And if I'm looking at just Ontario right now, we have several hundred plants across Ontario. We have hundreds of plants across Ontario, which are also non-municipal systems, and many privately managed as well. Many are privately managed as well, which are the ones you're not seeing here. Private septic systems. There are private labs that do regular testing for these municipal and non-municipal systems, but also we have in-house labs which are owned by these municipal or non-municipal systems as well. And at the same time, we have on-site testing for various different variables that we can do on-site to make sure that we have rapid results and so forth. So what we're trying to do right now is we're trying to propose a very coordinated approach for gaps in feasibility assessment for a potential system-wide application in Ontario related to infrastructure and resource implication, while ensuring that we work within the existing framework of system of testing and tracking, really based on what you see here. So again, I try to simplify this for us for discussions. But again, you have to understand it's a very complex system, and really bringing SARS-CoV-2 in this system is not an easy task. We do understand that there is going to be evolving and dynamic COVID-19 related issues and questions coming our way. There's always going to be new science being produced. There is going to be private industry proposals for engineering solutions. There's going to be potential top-down provincial and federal changes coming our way. We do believe there needs to be a well-coordinated, informed, and assured value consortium of wastewater professionals really who can help to really understand not just Ontario's specific interests, as much as I'm talking about Ontario as an example for us. It's a lesson learned from Ontario as I said, can be expanded to other places outside Ontario, but really that's what our consortium is doing. We're trying to answer questions that could help Ontario track the SARS-CoV-2 to help with a lot of those questions that I kind of talked about earlier. There are three key binding principles for COVID-19 consortium. We do want to make sure that it's going to be a shared focus. Obviously, we want to realize the local challenging realities and opportunities. We want to make sure there's going to be shared risk management. We want to early identify the current and future risk related to COVID-19 in wastewater to staff, operators, lab personnel, contractors, for example. We also want to make sure that there could be shared benefits, which simply means we want to pool resources, expertise, and funding for greater shared benefit as well. So really, we want to make sure that these three key binding principles are always going to be part of the work we're doing. So these are some of the critical milestones that we are working on right now. We are in the process of finalizing memberships right now, terms of references and the work plan. And that's almost completed for us. We are established technical advisory committee right now. So we're focusing on finalizing all the members that we want in the next month or so. And during this time, we're also going to finalize our technical advisory committee. We already initiated gap analysis and feasibility report. We're hoping to release this report by early winter. At the same time, everything is going in parallel. We're also doing small scale pilot tests. Right now, the sampling has started for us within various different municipalities in Ontario. The next, we're working very, very closely with many different labs right now to make sure that we have a consistent and consistent methodology to track the SARS-CoV-2 in wastewater. Now, apart from this is one of the last pieces of this study is to come up with an artificial intelligence-based centralized system that can track SARS-CoV-2 as a system-wide approach, across Ontario and eventually outside Ontario as well. There's going to be various different types of tools within this artificial intelligence system. We want to make sure that we can analyze data. We want to make sure there's going to be user management and confidentiality, because the data we are collecting for each municipality remains confidential for that municipality. And obviously we want to make sure if the government requires those results. Those are the only government officials can get it once we have an agreement in place with them. Threat level assessment and advanced early warning system. So we obviously want to do analysis of the data that we are receiving by using an AI-based system. We want to make sure that we use various different types of predictive algorithms and modeling, and come up with a centralized data stream methodology to have all of this data in one place to make sure that we can make the right decisions moving forward when it comes to opening or locking down of our economy. We have an opportunity and responsibility to really leverage our resources together, so learn from the current pandemic to investigate best practices. We want to identify and develop effective tools to better inform policymakers and decision makers. And as I said earlier, this is not just about COVID-19. COVID-19 is not the ending, but it's really the beginning for us to really understand how we can work together, not just for now, but also for future challenges, so that we can respond effectively as more for a Canadian-based approach rather than waiting for miracles to happen. So we want to make sure there could be quick responses coming from our way. If you are interested in becoming a partner of this initiative, we're selectively open to do a few pilot tests outside of Ontario and to provide proof of concept and share results and lessons learned with all across Canada. You can read more about our project. We do have a website now, www.cwco.ca. You can also see our research team, our student team, our leadership team as well. Along with this, you can also see the list of our current partners who are already participating in this project, and all the various different types of news coverage that we have done in the last few months related to our project. Dr. Gail Kransberg is the main principal investigator for this project, and I am the co-principal investigator for this project. Both of us are from Booth School of Engineering Practice and Technology. With this, as you can see at the bottom, our growing list of partners. These are not all of them. These are some of them for you to see that we do have lots of partners on board, and there is a huge interest all across Canada. We were on CBC News all across Canada to talk about this project, and we hope that some of you will be able to contact us. Our email addresses are listed here, javed@mcmaster.ca, but you can also find us on this website, www.cwco.ca. I'm more than happy to answer any questions for you. Thank you.
Hi, Dr. Jod. Thank you so much for your presentation.
No problem. Most welcome.
We have a few questions. Trent Campbell is asking, if we do a live sewer entry, what are the recommended precautions and safety guidelines we as operators should follow?
This is an interesting question. Right now, any kind of focus group discussions we had around Ontario with a lot of the municipalities when it comes to sampling. If you're just going there for sample collection, just your regular PPEs is going to be fine. Something obviously that we know about this virus right now, especially the virus is airborne, for example, we know about this, but now we also have made the connection that this virus is being shut off through people's feces into your wastewater plant. But the only thing we don't know right now is if this virus is viable or not, or if people are shutting off this virus in fragments, or is it a complete virus? We don't know. So as a safety precautions, making sure that you're wearing all the key PPEs that you would wear. Obviously, those are important. Wearing your mask, wearing your safety glasses, wearing your goggles. Those are very, very important. If you're doing sampling, obviously take all the precautions to, wash your hands properly afterwards, just like what you would do with any kind of microbiological sampling. You should continue on following the similar kind of safety precautions right now. Right now, nobody has changed anything till the science becomes available, which says the virus, which is within the wastewater, is viable and reproducible. We don't know yet.
Thank you very much. The next question, Rena is asking, at the present time, is there a cost to municipalities to participate in this study?
So usually what we ask is when a municipality join us, we don't just ask the municipality join us. We usually ask a few questions. For example, what kind of lab do you use? Do you have an in-house lab or do you have a private lab that you use? So when we are trying to work on this together, we work on with your existing framework, which simply means if you have an in-house lab, we will try to get your in-house lab on board to build their capacity. If you have a private lab that you're using, then we get those private labs on board. So for example, if you see a list of partners which are shown here right now, so we have examples here where we have partners that uses their own in-house lab. For example, Ottawa is an example here. City of Ottawa got its own in-house lab. So it's not just Ottawa, it's Ottawa's lab on board with us. Same goes with City of Hamilton. City of Hamilton is not joining us. It's their in-house lab also that's joining us. And so same goes with their operators too, because they will do the sample collection based on where we tell them. So we do that. And then we have a lot of partners that uses private labs such as SGS. So when we have municipalities that use private labs, we have reached out to the private labs as well. So to make sure that we are able to get the pairing going. So for example, Oxford County uses SGS. So Oxford County came along with the SGS as well to make that work. So the cost itself, when you initially start, if anyone wants to become a partner, we do ask the first is a technical expertise. If you have any technical expertise, you can join. If you can also provide in-kind support. So sample collection is from your end, and any kind of laboratory support that you can provide, that that kind of in-kind support can happen from your end. We do request a small seed funding of up to $5,000 from our partners. And that funding is usually used for two reasons. A, is used for hiring students, and that's where it goes. And secondly, it's used for purchasing equipments, because many of the labs all across Ontario, all across Canada, they don't have the equipments right now. So for us to build capacity, we need to purchase equipments and make sure they get transported to different places so we can build that capacity. So the cost initially, it's a $5,000 if you're looking for a dollar amount, but the rest is mostly in-kind support from your end.
Thank you. And we have one last question from Parrish, and it is, in the upcoming months, I think there could be a need to take more frequent samples for tracking. Do you think this would be rational? I'm from a small community with very few cases. I'm afraid there may have been cases missed here due to our remoteness.
This is a very good question as well. We're trying our best to get all the remote communities, First Nation communities, and so far to be part of the studies. Right now, for example, we have Town of Cochrane, as you can see in our list. We have Midland, for example, in our list too. Some of our smaller municipalities who do not have too many positive ones, but they're still very, very interested to join. Right now, we're just doing weekly sampling and testing, because we do realize that every municipality is going to, depending on population, depending on so many different factors. It's something that we work one-to-one with municipalities to really understand what is going to be the best frequency for your municipality. And based on that, we come up with something that's going to be cost effective for you, but at the same time, it's going to be consistent with what everyone else is doing. For example, we even decide on the time together, what time the sampling needs to be collected, what type of sampling needs to be collected, how does it need to get stored. So we guide you through all of those processes together. And usually you're not working on it alone. We have focus groups, so we pair a couple of municipalities together and we lead those discussions together to find answers to some of those questions.
Thank you so much, Dr. Jod. There is no more questions, but we just really appreciate you presenting on this topic today. It's of interest to so many of us. And we have your contact information if any of us are interested to contact you and perhaps be a partner. So thank you.
Thank you so much.